in 2022, FDA approved the use of prophylactic dexamethasone on day 0, 1, and 2 of CAR-T infusion in patients with aggressive lymphoma. This was ZUMA-1, cohort 6, and the study reported that these patients had a decrease in incidence of severe CRS and ICANS, decrease in dosage of cumulative steroid, and that use of prophylactic steroid did not negatively impact the CAR-T efficacy. We just wanted to see how this data was perceived across CAR-T centers in US and if they had adapted their practice in line with these new guidelines. So we surveyed 22 centers, out of which 17 responded. Only half of the centers actually had adapted their practice as per these new guidelines, and they were giving prophylactic steroids either to all patients or a subset of patients. So the pattern of practice was very variable, actually. The reasons for not adapting these practice was a potential change in patient population, smaller number of patients in the actual registration study, and also a larger, stronger evidence from prior studies suggesting that this may negatively impact the CAR-T efficacy. Some of the centers had contributed their data on patients who received prophylactic dex and also those who did not receive prophylactic dex. So in our study, we had a total of 44 patients, and the rates so far have been comparable for severity of CRS and ICANS, and there was no difference in outcomes. But we feel that a future study with larger cohort and longer follow-up is needed in the real world to really give a stronger evidence for implementation of this guideline in practice.